Hello, and welcome to video number 2 discussing weak knees and legs. If you missed our first video, we talked about exercises that you can do to strengthen your knees and your legs and avoid problems down the road. In this video, we're going to be talking more about what to do about it if you know you already have problems. If that sounds like you, stay tuned. There's 3 main areas that can contribute to knee problems. One of them can be a misalignment within the pelvic bones. And just to give you a simplified example here, if the pelvis is shifted, misaligned, it's going to carry the bones with it that are connected to that, in this case, the leg, the femur bone here. And what it'll do is cause a torquing sensation, sort of a twisting on the knee, can cause that knee to wear down unevenly on one side compared to the other, or one knee to wear down faster than the other. People often come in and they have knee pain in one knee and not the other, and they have x-rays and they've had doctors told them that they got arthritis and what have you, but it's only in one knee. So you have to ask the question, well, why is it in both knees? They're both just as old, aren't they? So it's an interesting question to ask people. Next thing is you can have misalignments within the knee itself, usually from some sort of injury or a long-term problem higher in the pelvis or lower in the feet, which we'll talk about here in a minute. And that can be evaluated by a chiropractor. Some physical therapists can evaluate that and determine if that's a problem for you and see what needs to be done about correcting that. Same thing with the pelvis. Pelvis can be evaluated by most any chiropractor to see if you have a misalignment issue there, and a physical therapist that's well versed within the field of manipulation can probably determine that as well. Lastly is within the feet. I've fixed many a knee problem by just getting somebody properly fitting orthotics, which is basically an insole for your shoe that is custom made and built up appropriately to give you the support that you need. Because what will happen is primarily what we see is people start losing their arches, or they're just always been flat-footed, and it causes the legs to turn in, again affecting the knee, causing a wear and tear process there. It can be evaluated by a podiatrist, a foot doctor. Most chiropractors can evaluate that, and some physical therapists as well. With this in mind, talking about the orthotics, my experience has been that the soft orthotics, you see this one's very flexible, work the best. People like them and people will wear them. People come in very often with hard orthotics. This one is very, very hard and stiff. They work for some people. Others come in here and they hate it. They said, well, I just quit wearing it because it hurt more than it helped. So for that reason, I don't recommend the hard orthotics, but that's more of a personal preference for everybody. Lastly, we're going to talk about what to do about it if you already have knee problems. From the medical standpoint, they're usually going to start with physical therapy, with some exercises, and then if that doesn't work, you're going to get some shots in there, some cortisone maybe. If that doesn't work, we move on to knee surgery and then a full knee replacement. Most of our patients come in wanting to avoid the surgery and the shots and the replacement. Most of them already tried the therapy and it just didn't work for them. So the first step obviously is a proper examination to determine where is the source of the problem. And then from there, the therapy that we've had huge success with is low-level laser therapy. The low-level laser is a healing laser. It's not a cutting or a burning laser. It's very gentle. It feels good. And it penetrates into the knee, will reduce inflammation, which that's where your pain comes from. If we reduce the inflammation, you're going to feel better. But it also increases blood circulation and it improves the tissue healing. So we've had huge results with that. People have come in told they need surgery, and we've been able to completely avoid the surgery, and they regain activity or are able to do the things they want to do with the procedures that we've recommended for them. So if some of what we've talked about has made sense to you and you see that you're having some of these problems, I'm going to encourage you, start doing something about it. look at our previous video and start doing some of those exercises. That's a good place to start here on your own without spending a lot of money. Next is to have your pelvis and your feet and your knees properly examined. Find out where the cause of this is coming from. If you already have a significant amount of wear and tear and you told you needed surgery or worse, a whole knee replacement, then I would encourage you to seek out somebody that does low-level laser therapy and see how that works for you. If you're local to the area, we would love to help. Even if you're not local, give us a call. Hopefully we can find somebody close by that can be of some help to you. So that's it for now. Thank you and God bless.